world has turned into. And we cannot just act like we don't understand the impact it's been having on us, on our daily lives, on our finances, on our relationships, on our health generally. It's been a lot of people that have dropped dead in the last couple of months, you know, and while some have been attributed to the COVID-19, others we know are not COVID related. Some people just couldn't handle the shock. Some people couldn't handle, you know, the situation, the changes that they had to encounter real quick. You know, their bodies were not really ready for them. So that's why we're having this, and I really appreciate whoever put this together, because you will be so amazed. And I mean, and I'm also going to be learning too. Most times when I do this kind of education or interaction, I find out that at the end of the day, I say things that I never knew, and I find myself learning all over. You know? So my name is Declan. My name is Declan Eden. Again, most of you, some of us, or I used to be known as Kechi Declan back in the days. But right now, I like to be called Edith or Cam, or Kechi reminds me of my late dad a lot. And I really try to, you know, keep that memory fast. So, but again, it's nice to see you all. I'm gonna try to, I cannot unmute. I'm
Okay, there
trying to
is there
unmute
is a
some.
last person, Edith. I don't know if she would like to introduce herself. Her video is off, but her audio is on now. That's the
Okay.
I, if you can hear me, that's who- who- that's Chukodlin Jubibo, I guess.
Yeah, yeah.
Yes, I'm
Okay,
the one.
okay.
Okay.
I'm I'm Chika Njubibo by name. 2006.
Okay. It's nice to meet you, Madam Chikodi. I really appreciate your presence. Unfortunately, we cannot see your video. So,
Oh, okay.
yeah, but it's okay. It's okay. You're welcome. Thank you so much for, calling in, and thank you all again for giving me this platform. I really, really appreciate it. I'm gonna, Mr. Ogana, can you please enable screen share? I'm trying to share my screen.
Okay.
Yeah, can you see me?
Yeah, we can see you. How are you doing today?
Hello?
Hello, we can see you.
Okay.
Yeah, we can see you. I think, Mr. Fred, I think you have to enable, like, somewhere on the setting, you should enable screen share. That way I can share my screen. But
Yeah,
I'll go.
I can see your screen already.
No, that's a Ghana screen.
That's my screen. It's all fine. Sorry, hold on.
Access before. Yeah, so I graduated in 2001, and I currently live in the US. I'm a registered nurse and a nurse educator. I teach nursing students as well as patients in the hospital. I'm a certified oncology nurse specialist. And what else? I also do a little bit of quality and safety in healthcare. So this is one of the things, I mean, this particular aspect of my career is what I love to do the most, teaching. I love to impact knowledge. I love to pass on information and all of that. So, I mean, I count this a privilege, doing this, with my alma mater. Yeah, so I'm gonna have to go straight into what we have for time's sake so that we can have enough time to ask our questions. Hopefully this is not gonna take so long so that, if we have other things to do, I know it's a Sunday and most of us would like to spend time with our family members. So I'm gonna share my screen real quick. Okay, so can you all see my screen?
Yeah.
Okay, good.
Yeah.
All right. So we'll be talking about sustaining your physical and mental health at tough times. And of course, we know this is the toughest time that we probably have ever encountered. I don't think anybody has seen anything worse than this period we're in. So this becomes a necessity that we learn about maintaining, a balance from on our physical and mental health, respectively. So a little bit of introduction. I kind of already talked about, the year and how it's affected. Does anybody know anybody who had COVID? Does any of you know anybody who had COVID-19?
For me,
Nobody wants. No,
I don't.
nobody even want to.
I don't even
Everybody
know
has it in
anyone.
Nigeria. Majority of people are suffering COVID in Nigeria.
Okay.
Me too. I've let me confess, I've gone through it too, but I've recovered.
Okay.
Oh,
Yeah.
Okay.
for you.
Yeah, thank God for you. I actually had COVID about 2 weeks ago, and it was the real bad one, really bad. I was on quarantine for 2 weeks. I haven't been to work in the last 1 month. I'm actually resuming work today. Yeah, it was horrible. It was the worst feeling in my entire life, and I'm able to talk about it today because I know what it, I know how I felt about it and how it affected me and affected my family. For the whole 2 weeks, I was in my room. My mom and my son would just bring my food and drop it by the door and run away. And I remember sometime my son came to the door and tried to whisper and said, "Mommy, can I just give you a hug?" I mean, that was the coldest thing that I felt, during that entire period. So it's a struggle. And then I know so many times I was scared because I hadn't worked for so long, and the bills keep coming every day. You don't tell your energy company or your insurance company or your mortgage company that you were sick. They won't take that. So while I was battling with being in isolation and being in quarantine, I was also battling with the mental stress of having to not pay my bills. I was scared what's going to happen to me, what's going to happen to my mom and my son, and then so it was a whole lot of, challenges that I was dealing with at the same time. So when we came up with this, when Mr. Fred came up with this topic, I really could relate with it, and I thought it would be a great one since we all can relate to the topic, and as regards to what's going on in our world today. So in order not to waste our time, I would like to just tell us a little bit about why we're having this presentation. So we are in some really troubling times, and let me take this away. And then the fear of the unknown, we're worried, we're stressed out. Our brother is, stuck in Nigeria, probably has a family over where he left and maybe businesses that he left. And our sister already told us she was sick of the COVID. And of course, when you're that sick, you probably can't even work. You can't relate with people. You cannot even relate with your immediate family members. So we see that the fear is out there. Even up until now, I've recovered, but I'm still scared of contracting the virus again. So when I went to work, the no what my, on going back to work now, I'm already having this whole mindset of, I have to be careful of people around. That's enough to put anyone in anxiety. Now there's a new reality. Children can go to school. Churches are shut down. Marketplaces are shut down. The world is just completely turned upside down. So that is why we're having this presentation. And it's not just going to be a presentation. We're going to be sharing our ideas. We're going to be talking through it. We're going to be sharing experiences and some tips and nuggets to help ourselves through the times. Okay, so the difference between physical and mental health is not as pronounced as we think. A lot of people, especially back home, we just don't have any, like, mental health is really not pronounced. People deal with a lot of mental health issues every day and nobody talks about it. It's normal. it's okay for someone to just commit suicide and, we'll blame it on his parents or on their church, or we'll curse the person, and all of that stuff. But people are dealing with mental health issues every day. People are depressed, people are anxious, people are nervous. These are all signs of mental health imbalance. Now, for years, researchers have been asking complex questions about how mental health and physical health interact. So the answer is predictably complicated, but we know that mental illness impacts physical and your physical health both directly and indirectly. So if you're not balanced mentally, think about it. If you see a madman on the street, for instance, you look at him, he's unkempt, he's, smelly, it affects his physical health too. In many cases, before you know it, the individual is gone, dead, or something happened to the person. So we're going to be establishing a relationship between your mental health and your physical health today. So what is mental health? I can't see everybody again. I hope I'm just, hello?
Yes,
Yeah,
I
you just did it.
Oh, okay. So what is mental health? According to the World Health Organization, mental health is a state of well-being where every individual is able to reach his or her potentials. So if you're able to reach your potential, if you're able to manage the normal stresses of your everyday life, if you're able to work productively and fruitfully, set goals, achieve them, and you can contribute to your community positively, then you are set to be in a very good mental health. Most people think about mental health as the absence of diagnosable disorders. So many people think that, oh, mental health is when somebody comes out on the street and starts screaming, or when somebody starts breaking things, or when somebody starts seeing things and saying things and acting erratically, then they're mentally disabled. No, mental health is way beyond, people having symptoms that we can see. And on one end of the spectrum, there are people who exhibit active resilience and are capable of taking life's uncertainties. So there are people who are strong enough. Whatever you throw at them, they are very quick, they can absorb it. Just like myself, I know when I was very sick, I would still be in my room and design programs, create websites. I was able to finish my 2-week quality and safety training while on isolation. So there are people who are very resilient and who will always put in their best and will succeed regardless of the situation. Now, there are others who, a little breakdown messes their whole functioning up. There are people who cannot handle little breakdowns. There are people who, a little challenge, they just sink in. They can't function anymore. Now, there are other people who fall in the middle. They're either very resilient or they break up easily. Those people will always tell you that their mental health is just fine. Now, your mental health cannot be just fine. It's either you are managing your stress adequately or you're not. Okay. So it's possible, even common, for people to fall in the middle, like I said. Now, if you do not have a diagnosed situation, schizophrenia, bipolar, it may not necessarily mean that you're managing your mental health properly, because before you know it, little things come up and it breaks you down real quick. Now, there are some signs that might indicate that there is a shift in your mental health. If you start noticing a change in your sleeping and eating pattern, you're not eating as much as you used to, or you're not sleeping well at night, you're awake for 3, 4, 5 hours while other people are sleeping, or you realize that you begin to withdraw from your friends, your family, you're no longer interested, you lose pleasure, you lose that desire to do the things that you were doing before. And then if you notice a loss of energy, your energy level keeps declining, you're tired all the time, you don't feel like interacting, you don't feel like socializing, you don't feel like talking to your husband or to your wife or to your kids, you're withdrawn. Yeah, it could be a sign that something is really happening. If you're also becoming increasingly irritable and having mood swings, every little thing gets you angry, every little thing makes you throw tantrums, you're shouting, you're yelling at people, then there might be a need for you to reassess your mental health. Also, if you begin to notice a decline or a loss of performance in your activities, it could be work, business, school, whatever, then it's time for you to actually have a check of your mental health. Now, we talked about physical health. We've talked a little bit about mental health. Now let's talk about physical health. Physical health has two components. It's nutrition and exercise. Good nutrition is essential for everyone, but growing bodies and of course we adults need more. A host of vitamins and minerals are essential to physical health, and at the right amount, they even work better. So I have this little picture here. I always like to tell people you are what you eat. Your brain is what you eat. If you stash your brain with a lot of carbs and a lot of fats, then yes, you're going to have a lot of carbs and fat deposited in your brain, and you don't want that. You want to, as much as possible, eat lots of fruits and vegetables. It's going to help your brain cells and help all of the functioning of your brain. Now, the second component of physical health is activity. I have this little picture over here, this lady. I mean, I know one time I tried to do this, but I couldn't even stand on one leg. But anyway, so activities will help you manage your mental health appropriately. It's increasingly challenging to ensure you get enough exercise and physical activity, especially when everybody's afraid of contacting something outside. But guess what? You don't even have to go outside. You don't even have to be on the field. You don't have to run the tracks. You can do a little activity in your room, in your bedroom, with the kids. You can just deliberately do things to get yourself as active as possible. Now, as an adult, and I always say this, but I never do it because I just, for whatever reason, I never do what I say. So as an adult, it's advisable for us to have at least 30 minutes of exercise every day for 5 days a week. That's enough to keep the heart pumping, to be able to pump blood to all the cells that are needed and to help us excrete whatever the body does not need. So we'll talk about depression. When we talk about mental health, it's very important for us to talk about depression. Depression is the most common mental disorder globally. Now, I know when I was in Nigeria, I never heard about the word depression, but over here, every single person is depressed. Everybody is depressed. And, you see the thing, back home, we were taught to be very resilient. I remember back in high school where all of us went. I was in high school for 6 years, and for one day, my parents never visited me because they didn't have the resources. We were struggling all through the time. So, but I know if that happened to any kid on this side of the world, they're going to turn it abused, they're going to be depressed, they're going to be suicidal, they're going to be, everything you can think of. So I give us a lot of credit. We are very resilient, we're very tough-skinned, and many times we are able to handle, stressors appropriately. But then let's not forget that there are people amongst us who are not able to manage their stresses appropriately or adequately. Some people break down easily, some people cry easily, some people are, they're frustrated, they're, overwhelmed, they sink back into their bodies and all of that. So we're going to be talking about depression, and depression is not necessarily waiting until your doctor says, hey, you're depressed. Depression is that moment when you feel so withdrawn, you lose pleasure, you're having mood swings, you don't want to talk to anyone, you feel bad, and all of that. So like I said, depression is the most common mental disorder globally. And this doesn't just impact mood and motivation. It can directly affect your immune system by suppressing your T cells. And this responses to virus and bacteria makes it easier for you to get sick. So when you suppress your T cells, which are the natural killer cells, they kill whatever bacteria or infection comes into your body. But again, because you're depressed, you're stressed out, these T cells are suppressed, and then your body becomes open to any kind of virus or infection. And I would not doubt it if that's the reason the COVID-19 has hit Americans really bad, because a lot of Americans are so depressed, stressed out, anxious, on medication, can barely handle, little things that come around them. So a weakened immune system can also lead to a jump in the severity of allergies and asthma. A lot of people here have allergies. A lot of people here have asthma. People are allergic to perfumes. People are allergic. Everybody you meet has an allergy. They have an allergy to eggs. They have an allergy to fish. They have an allergy to the air. it's one thing or the other. So when these things are present, it becomes even more difficult for your body system to build up enough immunity to fight bacteria and diseases. Some research suggests that it may be the other way around, that the immune system might also cause depression. We're not sure about that yet, but it's still on the process. Now, stress, especially the chronic kind of stress, if your body keeps, let me pause for a little bit. I'm gonna stop sharing. So I have over time tried to understand why people develop cancer. And I realized in my little study that stress destroys the immune system. Now, people who are overly stressed out, people who are worrying about things and, everything bothers them, their bodies cannot fight infections. Whatever comes into their bodies just sits in there and waits until it pulls them down. So stress is a major causative factor for every kind of chronic disease. If you're not stressing, if you're not worrying about things you cannot change, then the possibility is that you're going to be able to fight infections when they come around. All right, I'm going to go back to my screen for just a minute. Now, that stress, especially the chronic type, like I said, triggers an immune response within the brain. And this response may be a driving cause for depression and a lot of infections. All right. So a recent study on immune inflammation and depression involved the manipulation of immune responses in mice. We know the rats, the little rats. Researchers exposed these rats to repeated stress and observed that stress caused the rat's brain to release cytokines. And these cytokines are a type of protein associated with inflammation. So the release led to damage in the medial prefrontal cortex of the brain, which is a part of the brain that plays a critical role in depression. So excessive release of cytokines definitely damages the medial prefrontal cortex in the brain. And that is why we can see when that part of the brain gets damaged, the whole body begins to shut down because of stress, right? So a strong immune system is a hallmark of physical health, but the addition of stress increases the chances of depression. In turn, depression may further weaken your immune system, resulting in a discouraging cycle, which of course we don't want that. This case illustrates the fact that many health problems have physical and mental undertones. So, like I said in the beginning, we are responsible for managing our physical and mental health. Your mental health directly and indirectly is going to affect how well you are physically. So let's talk a little bit about fatigue. I know fatigue, a lot of us have fatigue, we're tired all the time. Even here, there's something called chronic fatigue syndrome where people are always tired for no reason. They sleep for 12 hours and wake up and they're still tired, right? I never heard about that back home. Like, why would you sleep and wake up and say you're tired? But of course, these are some of the things that we don't really know exist until we see people who have actually encountered them. So depression, anxiety, and other mood disorders often result in persistent feeling of tiredness. So people who are depressed, most times they don't want to interact. They're tired, they're fatigued, they're irritable, they have mood swings and all of that. They're exhausted. Every little thing, they're tired. Some inappropriately suggest that it's all in your head. Now, hey, I'm just tired, but it's all in my head. I'm going to go out there and I'll be fine. No, you're not going to be fine. You have to address whatever is causing the tiredness. But research shows that this is not the case. Being mentally tired results to physical tiredness also. A recent study from Bangor University in Wales in the UK, they had participants who rode a stationary bike until they reached the point of exhaustion. They defined exhaustion as the inability to keep up with the pace of 60 revolutions per minute for 5 or more seconds. So participants performed the test in 2 different situations. One, they rode the bike as usual. In the second setup, participants first engaged in the 90-minute task with elements drawing on memory, fast reactions, and inhibiting impulsive responses to stimuli. Now, after they finished riding the bicycle, they reported feeling tired and a little distressed. Importantly, these participants reached the point of exhaustion 15% earlier. So what are we trying to say? Mental health is closely linked to fatigue, and that persistent tiredness can easily lead to decline in physical health. So if your brain is tired, if something is affecting you, think about it. You have a relationship that is not working and you keep trying to make it work and it's really overwhelming you, it's pulling you down. You realize that 9 out of 10 times your body becomes unproductive. Your body is not able to do the things that it used to do before, even more. Your mind becomes unproductive because something is bothering you. When someone is chronically or physically anxious, they physically depressed or anxious, they are less likely to engage in exercise or to quit, and they're more likely to quit early if they do. Fatigue from mental illness can also interfere with basic hygiene. So people don't want to take a bath, they don't want to shower. They become increasingly vulnerable to diseases because, like I said earlier, stress affects your immune response. It increases cytokines, and it just causes a whole bunch of problems for your body. So you don't want to be stressed out. I mean, even though sometimes, like my mom will say, it's only a madman who doesn't get stressed when there's something to stress about. But hey, you can be in charge of the situation. You can be in charge of your body. You can be in charge of your mind and choose what to stress about. You shouldn't allow everything stress you out, because guess what? If you allow every single thing stress you up, your body is going to break down and not be able to fight against diseases and infections when you need them to. All right, so let's take a look at anger, anxiety, and the heart. How does anger, anxiety affect your heart? So anger outbursts, we see some people who just, get angry easily. They're stressed out. And again, think about it. Some people are so stressed out, they've been piling up and piling up and piling up all the stress and worries. And then easily they just, every little thing kind of triggers them and they just burst out and they're angry, right? Anger and anxiety really affect your heart health. Whether you like it or not, like I said, anger and anxiety really affect your heart health. An Australian study set out to see if acute emotions can cause heart attacks, like you see in movies, right? Somebody hears a bad news and all of a sudden their chest, and they pass out, right? Yes, this is so true. Anger and anxiety and emotional stress can actually affect your heart. Dr. Thomas Buckley, who led the study, said, our findings confirm that what has been suggested in prior studies and anecdotal evidence, that episodes of anger can act as a trigger for heart attack. So guess what? When you're angry, and I'm gonna talk a little bit about the physiology of the heart. When you're angry or you're stressed out, your blood vessels constrict. When your blood vessels constrict, there's not enough passage for blood throughout your organs. And so what happens? If you're angry, your blood vessels are constricting, you're not taking in enough oxygen, guess what? Your heart is gonna pack up. So that is where this whole presentation comes in. We wanna be in control of our health, we wanna be in control of our mental health, of our physical health, we wanna be in control of the things that stress us, we wanna be in control of what makes us happy and what makes us angry. Not everything should make you angry. You shouldn't even allow everything to make you angry. In 2 hours following a bout of intense anger, which the study defined as tense body language, a clenched fist or teeth, some people clench their fists really tight or their teeth and feeling ready to burst, a person's risk of heart attack becomes 8.5 times higher. So the more you're having anger outbursts, the more you're having stressors, the more you're allowing, situations stress you up, the more, that individual is likely to have a heart attack. In the case of anxiety, the risk of a heart attack rises to 9.5 times. While you are generally a long way away from having to worry about heart attacks, anger and anxiety involved in impulse control disorders can affect your heart. So what can you do to improve your mental health? Now, you need to take care of yourself. You need to take care of yourself. I know we have a culture of taking care of other people. We have a culture of, you grew up the whole time, you struggled growing up. The next thing you get married, the next thing you have kids, the next thing you're taking care of your old parents, and unfortunately, fortunately or unfortunately, if you're the first child in your house, you're going to be taking care of your younger ones, right? So we have to imbibe the culture. We have to practice the culture of self-care. You need to be able to take care of yourself first. That way you can take care of others. When I was sick and you know, in isolation, I was so worried about my mom, my son, my brothers. I was so worried about everyone. I didn't even think about myself. But what I didn't realize, but okay, I will definitely give you all the slides. So as soon as I realized that, you know, I have to be well to be able to take care of them, then it kind of changed my entire approach to the illness. But initially I was so down. I hate to use the word depressed, but I was really disturbed because I couldn't go to work. I couldn't see my mom. I couldn't see my son. I was locked up in a room, and the only time I could see the sunlight was when I opened my windows, you know. So yes, we have to be responsible. We have to take care of our health and take care of ourselves, because if you don't, nobody's going to take care of you. And guess what? The same problems you've been worrying about, the same situation you've been stressing about is still going to be there. Self-care is any action you take with the intention of preserving or improving your current mental or your mental health overall. Self-care activities serve two purposes. First, it sets healthy boundaries and develops the ability to cope with life's ups and downs. So it helps you set healthy boundaries. Oh, I don't want this to bother me. No, this is not going to bother me, because what I'm trying to take care of myself, and I'm not going to allow this situation, you know, throw me out or pull me down or whatever. And then secondly, it helps you, of course, when you're balanced, you know, you're able to think and take care of situations like you're supposed to. So first of all, I'm going to be sharing some self-care tips. First of all, you want to solidify a sleep schedule. If you've not been sleeping well, it's time for you to deliberately sleep like you're supposed to. About 8 hours sleep or 8 hours of sleep a night is just okay. Now, if you can't sleep, if you're having difficulty sleeping, the best thing to do is not to pick up your phone and text or chat or start looking on, you know, social media, because that's not going to let you sleep. The best thing to do is lay down, relax your brain. You can take a glass of tea, warm milk, whatever to help you sleep. But of course, sleep is very important for a good mental health and a good physical health as well. Now, not getting enough sleep can exacerbate mental health problems. According to a Harvard Medical School study, individuals with a history of insomnia, which is lack of sleep, are 4 times more likely to develop depression. Conversely, more than 50% of people with anxiety and up to 90% of people with depression experience sleep problems of some kind. So creating a schedule and routine around adequate sleep is very essential towards improving mental health and yourself. Developing a sleep routine can be as simple as setting a concrete bedtime. Oh, hey, I'm going to go to bed at 9 o'clock. And at 9 o'clock, you're in bed. Or limiting or removing screen access for up to an hour. Like I said, the more you watch TV, the more your eye cells are sensitized, and the more difficult it is for you to fall asleep. Or you can also take a herbal tea, whatever it is, some Lipton, something warm to warm your body, and then you can go to sleep. Get outside. I love this part of this this PowerPoint, because this is something I kind of learned to do recently. Every now and again, I just open the door and just stand outside and just, you know, breathing some fresh air and all that. So depression reduces the desire and motivation to get out of the house. People don't want to go out. Oh, you know, let's go see a movie. Oh, well, you can't see a movie now. Let's go, you know, do one thing. And the person says, hey, I don't want to do that. Or your husband calls you, come do this, or your wife calls you, or your kids call you, and you find out that you're lacking motivation to do anything. But when you get outside the house and walk around in nature, it helps decrease depressive symptoms. Make time for at least 2 hours outside or excursions per week. But we, of course, due to the situation of the country, it's not even safe to go anywhere. Even if it's a quick walk in your backyard or in your apartment or your house, you can just walk around deliberately. Before now, I used to, when I go to work, I work 12 hours per shift a day. I would just walk, you know, around the hallway for like 30 minutes. And yes, that kind of helped a lot. Also, if you want to make outside, activities a routine, that kind of helps your mental health and helps you set an actionable example for your kids if you have any. Schedule time for activities. Of course, so it's hard sometimes. We're busy, we have to work, we have to, do a whole lot of stuff. But I found out that people who actually schedule time for activities actually do better mentally. Working with your hands is not is not a waste of time. It's time-tested way to reduce the symptoms of depression, anxiety, and it also improve your mental health. Half of your brain's cortex is dedicated to the hands, so a hands-on hobby gives your brain a very good workout. You don't need to take up a mechanical engineering course to benefit from a hands-on activity, okay? You don't need to be a carpenter. You don't need to be a super handyman. Things as little as, mowing your lawn or cutting the grass or, I just decided recently to make some beads. That kind of just helps my mind relax many times. So when you use your hands adequately or effectively, many times it has been shown to help the brain function. Working with your hands is a tested way to reduce depression, of course, and improve your mental health. Like I said already, half of your brain's cortex is dedicated to your hands. You don't need to take up, I already said all of that. So now we can look at this, I like this picture because some people have told me in the past, hey, I'm pregnant. How can I exercise, because I'm pregnant? Hey, you can do it. You can take a walk in your backyard. You can take a walk in your apartment. Like I said, you can do bicycle riding. I actually decided to ride the bicycle for 10 minutes in the last couple of days. And riding alone helps the heart pump blood throughout your organs. All right, we're almost nearing the end of it. So a clear distinction has been made between the mind and the body. But of course, when we consider this, your mental health and your physical health are two things that are separate, but very, very important for balance. Poor physical health can lead to an increased risk for developing mental health problems. And mental health problems can also affect your physical health, which can lead to an increase in a whole lot of health conditions. Now, what do you do? Have we ever seen anyone? I'm gonna stop sharing so we can share our stories. Has anyone seen anybody who has dealt with a mental health illness? Has any of us seen anyone who had a mental health illness? And we can turn on our videos.
I've seen many mad people.
This guy can never change.
Let's
This
turn on
guy
our
can never change.
yeah, let's
Can you imagine?
our videos so we can share some of our stories. So you said you've seen a lot of mad people. Like, what do they really look like?
Yeah, yeah. Look at that kiss.
Look at Benon, he's one.
So you can turn on your videos.
Can you imagine?
You can turn on your videos. Yeah.
Can you imagine?
Okay. So let's share our stories. Have we, what do they look like? What do they say? Because the goal is, so you can realize or, you can identify when something bad is about to happen. I know sometimes we kind of minimize mental health illness, but it's a very serious issue. It's a very serious thing because some people are so mentally challenged that they're not able to function physically. And of course, we've seen people who just threw themselves out of a 20-story building or just hung, tied a rope around the fan and hung themselves. Those people were at some point normal, like every one of us. So what happens? How do we identify people in this situation? And what do they usually like? If you've seen someone, not like the one you just said. Yeah, so if you've seen someone who had a mental health challenge, it could be depression, anxiety, what do they say? How do they look? When you see them, how do they present to you?
The problem is, like you earlier stated, in Nigeria, we have this we don't really identify with depression and all that. So when it eventually gets to that state of madness per se, most times it's always we tend to identify that condition with maybe a kind of substance abuse, or things relating to that. So
Okay.
it's almost okay from my own end of it. It's almost difficult to see somebody who just maybe go off, maybe just by having some kind of. Sometimes most of the people I've come across with, they are just maybe substance abuse per se.
Substance
So I don't
abuse.
know if it relates to what you are talking about right now.
Yeah, absolutely. Absolutely. Now, I'm going to talk a little bit about substance abuse and mental health, substance abuse, managing stress and mental health. We're going to talk a little bit about that because whether we like it or not, I met a young boy who started taking marijuana, okay? And when I met him, everybody freaked out. They were really mad and upset at him. But my own worry was, why did he even think about doing that? Could it have been that he was so challenged by life? Could it have been that something was so wrong he couldn't manage it and then resorted to this type of coping mechanism? Because a lot of people don't just wake up and take up habits, right? Some people get, maybe their businesses just sunk down and then the next thing they decide to take a puff of something, right? And that's because they were not able to manage that situation appropriately. And then they become substance abusers and then they go crazy. So the inability to manage our daily life stressors can also lead to the use or dependence on substances and subsequently, losing their minds or going mad, like you said.
Sorry to cut you. Sorry to cut you. Like what you just mentioned now. My roommate is a type that he doesn't drink. He doesn't drink alcohol like me. So we all came to Nigeria, the kind of business we do, and the dollar crashes, and the guy lost about 14 million from that transaction. If you can remember, when dollar was the first time dollar flew up to close to 500, that the dollar crashes with 100 naira. So the guy lost about 14 million naira. Then when he came back to Istanbul, the guy started drinking. I asked him, Ike, why did you start drinking? He said, because he was depressed of that day, that he lost the money. He wanted to kill himself. So up to today, as we speak, the habit of drinking, instead of reducing, is increasing it day by day. Now he takes bottles, no problem. But I see that also can lead to that. When something hard hits, like me, I had such experience this year, but thank God that my wife was very close to talk to me. What I was thinking was just to end it, because we are scam, and I was involved in that scam of about 25 million naira. So I was just saying, I just came back. Well, what's all this? All the money I had, all the cash I had, will just go to the air like that. A lot of thought was coming, but when she sends songs, when she said let's pray, when she started talking, then I came back. The following day I went out for work. See, so it all depends who is close to you to talk to you when something hard hits you.
Right. Right. Thank you so much for sharing.
Okay, can I come in?
Sure.
Okay, for me, I think basically, Nigeria is wired to make you stressed. You really can't be in Nigeria and at this time, especially at this time, and not be stressed. From having to cope with finances and then, having to cope with what the government of the day is making us go through is enough to make one stressed and depressed. And then, having to cope with the uncertainties at work, you invest money and then with hope that you get your returns, and then at the end of the day, no returns. And sometimes you may have taken loans, and the people who gave you loans, get to your neck and you don't really know what to do. You know, you put all of these factors together, you just notice why a lot of Nigerians are stressed. Now, for me, I even think Nigerians have gone beyond being stressed. Let me say, since 2018, I would say more than 80% of Nigerians are actually on the level of neurosis as advanced stress. You know, that's why sometimes or should I say, when I was discussing with the chairman, I told him, yes, it's good for us to engage in a lot of social activities, but we need to talk about our mental states. A lot of people are losing it, but they don't know. You know, for example, sometimes the stress comes with having to, you know, take care of your work, your workplace. You know, that's the reality. A lot of Nigerians are doing more than 3 things to survive. You know, you are doing this, you are doing this business, you are doing this at the side, you are doing this hustle just to make sure ends meet. You know, at the end of the day, you now come home, the family stress is there, you have to pay bills, you have money to send to your siblings, or someone at the corner is asking you for help. You know, you put all this together, sometimes you start losing it. All of what you mentioned, you know, has happened to me in the recent times. I find it difficult to sleep very well. You know, you just discover that you're unnecessarily sad. You can't really point out what is making you sad. And then you just keep asking yourself, what exactly is going on? And then you just notice that somehow, headaches here and there. Now, late last year, up until this COVID issue became prominent, I lost a lot of friends to, you know, sudden, let me say it's heart attack. People just suddenly drop dead and they tell you, oh, it's heart attack and all kinds of things. So now, taking it back to what you said, I think the best thing for us is to look for what makes you happy. If you love music, engage a lot in music. If you love food, good food, engage a lot in good food. If you love maybe traveling, you know, just look for something that you love that takes your mind off, you know, the activities that build up stress in your life. Whether it's work, you know, sometimes when I close from work, do you know what I do? I switch off my phone. Like, I just switch off my phone and tell myself, until tomorrow, I am not going to pick anybody's call. Or I put my phone on silent and then leave it like that until the next morning. The next day, I start calling people who I feel, oh, these calls I miss are necessary. So I'm just chipping this, just maybe from my own personal experience before I forget. Thank you.
Thank you so much, sir. Thank you. Anybody else willing to share?
Me,
Okay.
I don't know why they like to laugh, but I think I have just few questions to ask. Is there a kind of a line that if you cross, as in if you cross, yes, it's difficult to come back when it comes to all these symptoms and everything? Because I, even for now, as of now, I'm having that sleep disorder. I'm having severe headache. Sometimes I just have to take some strong Panadol extra around here before I can function properly. This mood swing, yeah, I usually experience it, and I think sometimes I have this kind of I feel some kind of pain in my chest region, but my environment doesn't enable me to do the kind of exercise I may want to engage in, you know, because of maybe the restriction to movement and all that within my area. And my environment is a hostile one to foreigners, especially blacks. So it's difficult to engage in the things you would have normally loved to do, you know. So I just kind of, with all this exposure, is there a kind of a pinpoint, a point of no return or that kind of, and how swift can one recuperate from this kind of situation?
Okay. First of all, I'm gonna be very
different people, different countries. Some of my friends.
I'm sorry. Is anybody saying something?
Okay, go ahead.
I want to say something.
Please go ahead. Please go ahead. Okay. So first of all, we're gonna talk about coping mechanisms. We're gonna talk about coping mechanisms like our brother Fred had said. And then the other thing I want to talk about is having the right people around you at times of stress. Now, like I told you guys, when I got told that I had COVID, I was really sick. I was very sick. I have never been that sick. I couldn't get out of bed. Like I felt like the whole world was laying on top of me. I could not turn from my left side to my right side in bed. Running this very high fevers, and of course we know what fevers can cause. It can cause seizures. It can cause a whole lot of other things. So I was laying in my room. I was really scared, and then my mom had called some of her sisters and a lot of people from.
What to go?
Yeah, so my mom had told some people that I was sick, and of course it's the COVID season. So everybody, they were like, hey, the numbers in America, people are dying every day. People are dying. I kept hearing that. All I kept hearing was people are dying every day. People are dying every day. So that alone, if I had allowed it, I would have been broken down completely, maybe be dead by now. I remember when my doctor called me, when I first took the test, the next day the results were ready and she called me. And the first thing she said was, oh, Edith, we're sorry to tell you, you have COVID, you're having a fever, you're symptomatic, you're having pain, you're having this and that. And I was fine. I was okay. I was breathing normally. But as soon as she kept talking about, you have shortness of breath, you need to go to the emergency room. If you have shortness of breath, you need to go to the emergency room. Honestly, from that minute, I started having shortness of breath. Like for a minute, the whole reality just hit me so hard that really, I in the emergency room, having a tube down my throat because I can't breathe. So I was really scared about the situation. So like you said, Mr. Nakalamba, the goal to managing stress is being in the right company. If you don't have the right people around you at any point in time, those people are even going to constitute more problems for you. So if you're having to go through any stress, if that environment does not enable recovery, you need to separate yourself from that environment. You need to take yourself to an environment that is enabling, an environment that is healing, so that you can reach your optimum function. Then we're talking about coping mechanisms. Why would somebody, I talked to my brother and a few young people a few weeks ago. I asked them, how would you go to the market with a gun to supply? That's what it means when you resort to using wrong mechanisms. So you lost 40 million naira and you decided to go drinking, forgetting that even your liver is not worth 40 million naira. That liver you're damaging with alcohol is not worth the 14 million naira you lost. So it sounds like into the marketplace with a gun to shoot a fly. You're going to be shooting everything in the market besides the fly. So if you're having to go through any stressful moments, I want to tell you at this that using the wrong coping mechanisms like drinking, smoking, having unprotected sex, rampantly is not going to solve the matter, because guess what? That problem is going to be taken care of or it's going to be passed, but then you're having to damage your system, you're having to damage your organs, which money might not be able to buy. And that's why we're having this conversation today, to enable each other. We need to strengthen each other. We need to get each other to understand that we'll be here for each other. We'll share suggestions and ideas to help us go through whatever we're going through in life. Now, stress affects your mental health and your physical health. Like I explained earlier, the more you have sleepless nights, guess what? You don't have enough blood to your brain. Your heart is not pumping enough blood to your organs. And then you start having a cluster headache. It's called a cluster headache or a tension headache or even migraines. And when you continuously have these headaches, definitely it's going to cause your heart to shut down. And it really exposes your body to masses and cancerous cells and even regular cells that will just grow up and become cancer, because you have made your body system what do you call it, a habitation for this now let me tell you what happens when you don't sleep at night. Usually the body goes through a cycle. And that cycle, when the body goes through that cycle at night, the body eradicates or takes off toxins. So those toxins that are leaving the body do that when you're resting. But because you're not able to sleep, because you've allowed yourself to be stressed out, those toxins begin to pile up in your system. And those are the things that cause you to have a stroke, cause you to have high cholesterol, cause you to have cancer, cause you to have mental breakdown, it causes you a whole lot of things. And that's why when I started, I said, you need to take care of yourself. I like the Bible passage that says, this shall pass. That's what I tell myself every single time. You shall pass. It doesn't matter what's going on in your life. You have to take care of yourself. So let me see if we have any more things to do with the PowerPoint. So we already talked about, sorry, I'm just trying to make sure that I have another presentation. So I'm gonna try to be as quick as possible. So we already talked about managing our mental health and then how to identify people who are dealing with mental health issues. So first of all, you want to assess for the risk of suicide or harm, okay? If you have someone dealing with a mental health problem, you want to make sure that they don't have access to a gun, they don't have access to a knife. You want to talk to them and find out what exactly they're feeling and how you can help them. Identify if they're experiencing a crisis such as a panic attack or suicidal thoughts. So if you have a friend who every time talks about, oh, I can't handle this, I can't handle this, I just wish I'll close my eyes and this would be over. I just wish somebody's just gonna kill me. I just wish my life would just end. Then that person really needs help, and it's up to you to provide them. So it's okay to do an assessment, and even it could be over the phone. You could go reach out to them in their houses. And of course, if you have access to any emergency care, you can dial whatever number is available. Now, you have to be non-judgmental. People are going through a lot of stuff. People are stressed out. People are worrying. But you cannot tell them that what you did yesterday or what's going on is because your father did something that somebody, you don't want to be judgmental. That is not a point. That is not a time for you to be judgmental of anyone. You want to listen without judging. You want to give reassurance. Tell them everything is going to be okay. Tell them that this is just momentary. Everything that we're experiencing today, as long as we are alive, by taking care of ourselves, we're going to be all alive, and we're going to be all there to tell the story of what happened. So you also want to encourage them and help them seek professional help. You want to encourage self-help. Tell them about taking care of themselves and some support strategies. You want to also teach them about strategies like deep breaths, walking outside, less on the problem and being more thankful for things that we cannot buy, like life. You want to encourage people. You want to tell them, about the great things that lie ahead, about the things that they can achieve if they stop worrying. Now, this is what you should not do, okay? Don't tell someone who is stressed to snap out of it. Nah, what if it's their power? Nah, or hey, what are you talking about? People have been through that before and they're fine. No, don't minimize their situation. Don't adopt or over-involve or be protective towards them. If somebody is depressed, just leave them alone. You can send them messages like our brother's wife did for him. Send them, things to cheer up their spirits. But don't try to becloud their spaces. Don't try to make them feel like, they really don't want you around. you shouldn't ignore or disagree or dismiss the person's feelings. Like I said, if somebody is dealing with something, acknowledge the problem, acknowledge their feelings, and that way you can help them proffer suggestions that may or may not work. But of course, you tried. We must come to terms with our imperfections. And when I say imperfections, a lot of us are perfectionists. Myself, I'm gonna use this example. I so believe in making everything right. Everything has to be perfect, you know, but so many occurrences, I've had to encounter a lot of situations in my personal life that just made me come up with this conclusion that I'm not perfect, and I have to acknowledge it. I have to accept my imperfections. I have to accept the fact that everything is not gonna be just great. So we have to acknowledge that imperfection and accept that we need to balance up. It's important to try and strike a balance between giving yourself enough space and time to feel whatever emotions you're coming up with and staying productive. So yeah, you should acknowledge your feelings. You know, you lost a lot of money. The economy is crashed completely. Your kids don't have food. Your wife doesn't have food to eat or clothes to wear. Your rent is expired. Your landlord is about to chase you out of the house. Your car is broken down. Acknowledge it. It's okay. You cannot live in denial. You first of all acknowledge the situation, and then by yourself decide that you're going to balance things up. In tough times, we often have a lot, we've had to let go of routines. Maybe praying. To some people, they've been able to pray as a way of managing their stresses, which is okay. Some people love to cook, some people love to, or some guys would like to hang out and, you know, have fun with other guys. But because of the tough times, we've not been able to do that. So we stop exercising, we start eating anything we see, and our sleep schedule goes out of the window. We essentially stop living our lives and get stuck in the pain. So while it's very important to acknowledge and validate work, validate your stress, validate the challenges that you're going, it is also important to continue to do what you would do typically to be productive. So this brings us to the end of this, but I'm gonna open up. Stanley's hand is up. Oh, I'm sorry, Mr. Stanley, you had something to say. I'm so sorry. Now, some people are mute. If you muted yourself, please go ahead and unmute yourself so we can hear you when you talk. So, does anyone have any experience to share? Like, we're going to talk a little bit. I mean, this is a family. I know most of us were through the pains of the past, and some of us have, you know, excelled, and some of us are still in the process. Definitely, we're going to get there. It might not look like it right now, but we're definitely going to get there. So does anybody have any like experiences they want to share and how they were able to help hurting their mental health?
Yeah, I have something to say. Can you hear me?
Yes, ma'am.
Yeah.
I have something to say. Some years ago, I was kidnapped, and I went through hell in the hands of the kidnappers. And after that, I had trust issues. I don't trust people. I don't know whether that is also a mental disorder or mental kind of illness. I don't understand. I don't trust people. Even when I had reason to trust them, I would just wave.
That's a very it's a post-traumatic stress disorder. Now it happens typically.
Your house. See your daddy, see your mommy, see your brother. You're crying, you want to go.
Okay, so that's called a post-traumatic stress disorder. So you've been traumatized in a way, and then every time you're reminded of that singular experience, correct?
Yeah.
Yes, everybody comes around you. Now, like I said, the first thing to do is to acknowledge it. And you're not alone. You are not alone. I've had some personal encounters in my life that made me lose trust in people. Most times when people try to be nice to me, I'm scared that they probably trying to hurt me or something. So
exactly.
Many times I've had to say, Edith, now you need to take a break. okay? This person is not like the people you've met in the past. This person does not mean any harm. This person, the best you can do is to open up yourself, but again, reserve a part of you. Give them the benefit of the doubt. Because everybody is not going to be like whoever you experienced in the past or whoever hurt you in the past. So you have to acknowledge the fact that, yes, I'm scared. I feel vulnerable. I feel like, like people took advantage of me. People I trusted took advantage of me. But again, I have to move on, and I cannot move on all by myself. You still need people to move on. And in order to, move on, you need to trust them. So you have to acknowledge it, come to a point where you tell yourself, yes, this has happened, but it may not happen again, and it's not going to happen again. But it's up to you to open up your mind. But again, reserve a part of you. But open up your mind when you meet people. And that way you can, there's no medication for PTSD, except it gets to the point where they can't sleep at night. Some people get raped, and then even in their dreams, they see people are raping them. That's PTSD. When everybody they see reminds them of that rape, and they want to lock themselves up in the closet, they want to hide under the table when they see people. That's the very traumatic part of PTSD. And at that point, yes, they might be given medications to manage their symptoms. So, but right now, where you are, you want to acknowledge whatever has happened, and it was not your fault. It was never your fault that whatever happened. It just happened that way. But again, it's there to teach you a couple of lessons and to help you understand how to manage people and relationships better. Okay?
Yes. Yeah.
All right.
Okay, I would like to add something to that. Is that okay?
Sure.
Yeah, I'm listening.
I also think when you have such conditions and you try to manage the condition all by yourself, and you discover that you are not having a go-ahead, always try to see a therapist or a professional who can maybe counsel you and guide you all through, you understand, the stages of those problems. I think in this part of the world, we do not always see the need to seek counsel or see professionals or experts early enough. You understand? Sometimes, for example, you see someone who is, it's obvious this person is losing his or her mind, and then what people do is they start praying for the person. They take the person to all kinds of churches, I think if you had just decided to take that person to see maybe a psychiatrist or maybe an expert in that field, it might even save that person, early enough, or even, save that person a lot of stress or having to, go beyond the problems of that time. So for me, I also think when you encounter some problems and you feel you have done everything as a human being, everything possible to handle that problem, and you see that, man, I am not able to cope with all this, quickly see an expert. It will save you a lot. Thank you.
Yeah. Thank you.
so much. Okay.
Yeah.
Anybody else willing to share an experience and how they managed it with?
I don't know if Stanley is still around. I've been asking to unmute him, but he's not unmuting himself.
You can unmute them, right?
Yes, I have, but I have to unmute. If I ask you to unmute yourself, then you just unmute yourself and then.
Okay, I don't know if he's here. Anybody else wants to share an experience with us?
If I just want to add, what if the source of my stress is financial issues, instead of all this counseling and big grammar, if people like as people are now just contribute money and leave me, would I be okay?
guy, a stupid guy. Very stupid human being.
You see, that's
You're
a
very
very,
stupid. Me, I'm going through financial stress. I also need a contribution. Please, people should contribute for me.
Yeah.
so I mean,
Contribution
what you're
everywhere.
saying is very correct. What you're saying is very correct. And when I was this message, I wasn't sure who I wasn't quite sure who the class I was going to be addressing, but when like when people go to church, the pastor prays and says, somebody goes to church with a financial problem, person goes home and that problem is still there, right? So whatever when you're proffering solutions to people's problems, many times, you want to come up with workable solutions. We're in a very difficult time. The whole world is turned upside down, and like I told you guys, I was home for a month, and here we pay our bills like every month. Bills are, approximately $4,000 of bills every month. And now imagine you not even going to work. I was losing my mind. I was going crazy. But then I told myself, I said, the worst that will happen is we're going to be sent out of the house, and we won't be able to have a place or whatever. But having said all this to all of you, I'm gonna get with Mr. Ogonna. I'm gonna get with Fred. I'm gonna get with Fred. I'll make a very small contribution, just to help, those of us that are struggling with whatever. It's I don't know. It might not be a lot, but at least it's gonna be something. Honestly.
Everybody can't you wait. Everybody wait.
Both of us that said it. Nobody said something.
I want to ask a question. Hello.
Thumbs up.
Hello.
Hi.
Yes, sir.
Can hear you.
Hello, can you hear me?
Yes.
Yeah. Can
Okay.
hear you.
My question is, sorry, I've been on and off. I've been on and off between two meetings. This one and the other one. So my question was about the depression, mood swing, and all that. And you made mention of sleeping disturbance. Like me, I've been experiencing this for like over 10 years now. That whenever I sleep, once it's 3 a.m., sleep goes off my eye. I can't sleep till let's say 5, 6. I'll start feeling sleepy, and sometimes it makes me look lazy because when I'm supposed to wake up and start doing something for the day, you see me sleeping. So it has affected my job. And I also found out that I don't have this zeal to exercise any longer. I used to play active football, though not professional football anyways. I just play football to keep fit. So I just found out that I've lost interest in active sports. Like few occasions that my wife wants us to do exercise together, she's the one that is always pushing me. I would just do exercise for like few minutes. I think there was a few days back that I tried doing exercise for like 1 hour, and after that 1 hour exercise I fell sick for like for like 2 days or so. But since then I've been trying to push myself to do something, because I know that since I stopped doing active exercise, especially since I stopped playing football, I've been experiencing all manner of sickness. I easily fall ill, as in every time I'm treating malaria and typhoid especially, and this sleeping disturbance thing. So I want to know if it is something that has to do with the stuffs you mentioned or something else.
Okay. So first of all, let me talk about your sleep disorder, disturbance. I'm not going to say disorder. So for the sleep disturbance, first of all, what time do you go to bed at night?
It's not. It's random. It's random. I cannot really say. Yeah, it's random. Sometimes.
I can barely hear you.
Ben, stop making noise.
Yeah, can you hear me?
Yes, sir.
Sometimes. Yeah. Sometimes I sleep by 9. Sometimes my job has to do with engineering design. So sometimes I have some designs that I will do late into the night, like 12 a.m., 1 a.m. It's not always, but sometimes I do stay after 12 before going to bed. Sometimes I sleep around 9, sometimes I sleep around 8, sometimes 10. But once it's 3 a.m., sleep will just go out of my eye.
Okay. So the reason I asked what time you go to bed, you know, sometimes when we have some situations, whoever is going through that situation is in the best position to help him or herself out. Now, I always advise that people try some techniques personally before, and if it doesn't work, just like our brother, you might need to go seek help. But waking up at 3 o'clock in the morning is not a problem. The problem is you need to set a sleep time at night. So that way, if you set your bedtime for 8 o'clock at night, 9, 10, 11, 12, 1, 2, 3, you're getting 7 hours of sleep. So since you know that you're waking up at 3 o'clock, and if you don't sleep well, you're going to be very unproductive.
Exactly.
So knowing that you wake up at 3 o'clock and you've not been able to sleep past 3 o'clock, you can deliberately decide for your body to go to sleep at least by 8 o'clock, so you can get at least 7 hours of sleep. Okay, I don't know if that helps. Then if it doesn't work, I really don't like, asking people to go try medications and all of that. But a little bit of melatonin is just like the normal hormone that's, that tells us it's nighttime, you need to sleep. So they have them in pills. I don't know if you have them back in Nigeria, but some people just take a very low dose of melatonin and it helps them sleep all night. But first of all, like I said, try to go to bed early. If you wake up at 3 o'clock, sometimes I find myself waking up at 1 o'clock and then I don't go to sleep again for the whole day. But trust me, anytime I feel like sleeping, I just put my head on the bed and I'm gone. So set a sleep routine. We're not growing any younger. The more you're not able to sleep well, the less your body is able to function. And the more it's going to affect you as we grow older.
Right.
Make a deliberate effort to sleep. Make a deliberate effort to sleep. Set a sleep time. It doesn't matter what you're doing. 8 o'clock at night, you pack up, maybe take a bath, take a warm glass of milk or warm tea, and go to bed. And even if you wake up at 3 o'clock in the morning, you've gotten some decent amount of sleep. Okay? All right.
Please, I have a question.
Yes, sir.
My question is based on this sleep. Most times you hear some persons who say, I work to make money, I work and I don't sleep. I just sleep 1 hour, I sleep 2 hours and what have you. And now my question is, you are saying that when you don't sleep well, it will affect you at old age. And it will equally affect the functionalities of your systems. Now, what happened to these persons? Because I've seen many persons say this. They don't sleep, they are working, they are thinking and what have you. So I need a clarification. Thank you.
Okay, so just a second. All right, so when I talk about lack of sleep and affecting our old age, this is something that we can all relate to. The brain is constantly working, correct? The brain is like 24/7. If you don't lay down to sleep, your brain is working. Now, as we age, our brain cells decline. They decline in the ability to, function and all that. If you don't get enough sleep, you're definitely exposing yourself to things like memory loss. Think about it. If you don't sleep well, does it affect your ability to remember things? Is your brain the smartest when you don't sleep?
At least I know when you don't sleep, you are having when you are being stressed up as a result of you didn't sleep. I know it will definitely affect you. You'll be feeling somehow. I know it does.
So when you don't sleep, you know, your system is kind of sluggish, your brain is sluggish, you know, and that also affects your ability to carry out your activities because, you know, you haven't gotten enough rest. So think about when that happens chronically over a long time. It predisposes the individual to illnesses such as dementia and Alzheimer's. So you see people who are 60 something and 70 something and then they forget about everything. That's because their brain for a while has not been functioning like it's supposed to. They haven't had the chance to rest their brain cells, so the brain cells have not been at their optimal function. So like I said, we have to, I understand the situation, you know, there's a lot of problems, but think about it. If, God forbid, if anybody drops dead right now, those problems are still gonna be there. Those problems are still gonna be there. So we owe ourselves, if we wanna be able to, you know, gradually solve these problems, we have to be at our best health status. We have to be at our best mental health. And of course, having adequate sleep, having sufficient sleep helps with maintaining a balanced mental and physical health. So yes, you know, especially as we grow older, you know, as a man, you have all these responsibilities, but if you break down, those responsibilities are still gonna be there. And then you will be an additional responsibility to whoever is left in the family. So the word is deliberate effort, constant deliberate effort. Schedule your sleep time. When it's time to sleep, what I do, I have a cell phone, I have a bunch of things that I do over here. When it's time for me to sleep, I put my phone on silent. I'm sorry, I just have to sleep. Okay. So anybody, I'm gonna try to add how lack of sleep affects your brain. I'm gonna add that to the PowerPoint that I'll send to you all in just.
Okay, can I say something?
Yes, sir.
To Mr. Christopher, I am going to say I have been through what you're currently going through. Mine even started right from my university days. I tried to read too much, so I killed sleep. I was doing my reading at night, so I got used to it. So when I left school, it was difficult for me to sleep at night. You know, my night now functions like it's the daytime. So, but so it affected me for a very long time. But then I discovered that somehow I was able to overcome it. But it was still around my, what helped was exercising and my eating habits. I try to make sure that once it's 5, 6 o'clock, after 6 o'clock, don't eat anything heavy, you know. And then if perchance you still find yourself waking up at that 3 a.m., what I think you should do is maybe exercise, you know, force your body to do something that the body doesn't like, but is needful for the body. If at that 3 a.m. you can maybe do press up, if you're inside your house, you can't come outside, you can jump up, you know, just do something. If you're someone who likes music, I mean, well, you have to disturb your household. But if you live alone, you know, just exercise your body at that time and then change the format of your system. Because if you exercise, it's healthy at that time. Exercise, you can exercise at any time, midnight, early morning, you know. And then you discover that after some months, your body will start adjusting. You know, your body is no longer used to that regular wake up at 3 o'clock. Your body will now just start, you know, shedding off that way it gets used to. You sleep at this time, you wake up by 3, you know. And like you said, Edith, the best thing is to sleep early. Once I leave work, I make sure unless it's something that is very, very, very important. I leave it at work. I shut down at work. I come home, switch off my phone, or if I don't switch off my phone is on silent. I don't have to, engage myself over work again or work-related activities. Shut down, stay with your family, stay with your friends, 1 or 2 hours after work, bath, sleep. If you wake up again at that 3 a.m., instead of maybe watching movie or reading a book, it's good to read a book, but at that time, it is not very healthy. Do something that is healthy for your body. And the best thing at that time is to exercise yourself. Do a lot of press up, do a lot of jumping up and down, or if you have something around your household that can just make you move around, engage your body physically, just keep doing that. Then you find out that over the months, your body will switch again and get used to that relaxed mode. And you just discover that you can now sleep and go beyond that 3 a.m. You know how it started, but you just notice that after some time, you can sleep and go beyond 3 a.m., maybe up to 5 a.m. Sometimes if you're very tired, you can get up to 6 a.m. And then speak to your mind a lot. For example, when it's a Friday, I always tell myself, before I sleep, I make it a reality. See, I'm going to sleep till whenever I like. I don't have to wake up early. There is no work tomorrow. I speak that to my mind and that's it. And somehow it helps, calibrate my mindset. So like Edith said, you have to make, even if you see a doctor, all of these are what they're going to ask you to do. You have to make delegate yourself. Like the way you also go to work and draw out a chart of, your work schedule, your job function, what you're to do and achieve today, this week. Do that for your body. Okay, today I'm going to sleep by this time. If I wake up by this time, this is what I'm going to do. If I do this, you do it for your body, because the truth is we are nearing 40. Some of us are even up to 40 or more. My brothers and sisters, our bodies are aging. And I won't lie to you, a lot of people are just dying unnecessarily because of things like this. You just hear this person just dropped there. What happened to him? He was okay, or he just fainted, or he just collapsed, or he just went to bed and he didn't wake up. And then they check and you discover that it was just simple stress or simple, bad habits, not taking care of one's body. So that's all I want to say for now. Thank you.
Okay. Now, I'm gonna also, I thank you so much, Mr. Fred, for that powerful contribution. I really appreciate that, and I'm so glad that you're able to share this. Now, talking about exercise, also, exercise is very good. Okay, when you exercise, your body releases a lot of hormones that help your body relax. Now, when you talk about exercising for an hour, I would suggest that you start small, start gradually. When I try to, I try to talk about things that I've done myself. I preach or talk or teach about exercise, but personally, I've not been able to do much. So what I did was I started off with maybe 10 minutes of walking. I just walk like casually around the neighborhood. And then I brought it up to, jogging. I could jog for like 2 blocks and then I'm tired and I stop. And then I go back home. I'm not discouraged. The next day I jog for 3. If you try to do all at once, like you said, your body is going to break down. You're going to be so sore. You can't get up again and exercise for another 2 to 3 weeks. So the best way to exercise, and we have to do that, especially as the men, as like Fred said, we're getting older, everything is declining in function. So you need to exercise to boost that ability for your blood vessels to pump, to constrict and relax as necessary. Okay, so gradual exercise is just key. You don't have to do a lot at once, okay? Start slowly, inhale a lot of oxygen, a lot of air, fill up your lungs as much as you can, and then go to sleep at night. And I'll just leave my contact. You can always, we can talk about this a little later. So I know at what point you might need some extra help. Okay?
Yeah.
All right. Mr. Mordi.
The sex exercise.
Yes, sir.
Okay. God bless you.
All right.
Nonsense boy.
Okay. So I think I got a message from Mr. Dan. Thank you so much, Mr. Dan, for your contribution. I see you in the barber shop, and we're not expecting you to to say a lot. But here, alcohol. He had a question about alcohol and mental health. So the reason a lot of people, alcohol is good, but when it becomes excessive, then of course it becomes a problem. Now, let me tell you, there is a particular, I'm trying to remember the name. There is a particular mental disorder. It's called Wernicke-Korsakoff alcohol, syndrome. Let me get the right name because, let me see. One second, I'm trying to get the right, but basically alcohol, think about what alcohol does. In small quantities, it might be okay, but when it's a lot, it inhibits a lot of functions in our body. It slows down everything. And anything that is capable of slowing down your thought process, anything that is capable of slowing down, your activity, definitely detrimental to your mental health. Now, drinking a whole lot inhibits a whole lot of activities. Consumption can mean fewer personal constraints, and additionally, alcohol can it disrupts our body's ability to get the normal rest. It also results in the body needing to work harder, and it breaks down, to break down the alcohol. So when you drink, it breaks down a whole lot of functions in the body. What we want. Whatever makes your brain or whatever reduces the function of your brain has a tendency for affecting your mental health in the long run. I don't know if that answers our question. Okay, yeah. So Fred already gave us the answer. If it's not moderate, little or moderate, then yes, it can affect us. Let me tell you all, there is something called hepatic encephalopathy, and that is when the liver function declines, or when the liver stops functioning, and then it cannot excrete toxins or break down or remove toxins. These toxins begin to build up in the brain, and then it causes some kind of event called hepatic encephalopathy. Now, alcohol destroys your liver. Alcohol can result in cirrhosis, something called cirrhosis, where there's a lot of scarring of the liver. So if you take alcohol in large quantities, it can definitely destroy the liver, and consequently cause encephalopathy. And some that is not very somebody needs to turn down their or put the sound.
Ben is
Okay. Yeah, so this affects the brain, it affects the brain cells, it depletes the individual of thiamine. Thiamine is a vitamin or a nutrient that the brain needs to function. So excessive alcohol definitely depletes the body of thiamine, and this causes a lot of neurological symptoms. Okay? All right.
Okay, Edith, I guess so that we don't stretch you beyond, I know you have other engagements.
I was gonna say that now. It's already 1 o'clock. I have another presentation in about an hour, and I have to get ready for that.
Okay,
So and I have to go to work later tonight. Oh my God.
All right, what will happen is if there are other concerns after now, maybe we'll put them together and then send them to you. Then you can, do us a response. Then we'd also appreciate that you fine-tune your presentation, and then I'll send you my email.
Okay.
Then I can share it on the platform just for those who were not able to connect, or or those who were not able to follow us today. And then we know that some of that time we may still need you to come up again to discuss 1 or 2 issues with us. I'm sure you oblige us that if we ask for that.
Definitely, absolutely.
Okay.
Yeah. Again, it's my pleasure. I really appreciate every one of you. Thank you so much for this opportunity. I really really do appreciate it, and I look forward to meeting with every one of us physically sometime. I don't know when that's gonna be, but yeah. Thank you all so much.
Yeah, appreciate you.
Thank you. All
Okay.
right.
Much love. Thank you. Thanks for your time too.
Thank you so much.
Okay. All right. So
God
we draw
bless
this
you.
session to close. We have just 2 or 3 minutes to say pleasantries, exchange pleasantries. Then we can just close this session. And let me seize this opportunity again to thank you, Edith, and God bless you. I know what it takes to sit down and do a PowerPoint presentation that you're not going to be paid for. So some of these sessions like this are actually paid for, but thank you for giving it to us free, and God will continue to bless you. And my regards to your son
Thank you
and your
too.
brothers and your mom.
Thank you so much. I definitely will. All right. Y'all have a good one. I'm going to exit and y'all can continue.
All right. Thank you very much.
Thank you. Thank you.
Your family.
All right. Thank you. Bye-bye.
You are the best. Don't tell anybody. Yes.
She's always the best, no?
Where is Onakalamba?
He's sleeping. But he has gone to drink alcohol. Emodi, cool down now. Why is your blood hot? Calm down, calm down. Allow God to use you for once. Allow God to use you for once. You people should give offering. I'm going to drop back.
The money is for the platform. It's for the social committee.
He's a liar. Don't try me.
Oh. I've already started making lists too. I've started making lists.
I will give it to you back.
I've started making lists.
Allow the money to come in first now. Eh?
Why are you people like this now?
You need
God,
money.
Chika, it's not that you be flashing yourself light.
What? What?
Nah, but the need it. Kita came and you go see what could you do?
There's no light. Come,
pack out from there. Pack out and come to and stay in my place. Pack out.
See your life.
My life is beautiful. I know. I don't need anybody to tell me.
Okay.
Maxwell, I heard is not here because they will not use
unmute
the money
yourself now so that you can close this session.
Ogonna, I don't know what I do you. This one way you go put me for. They want to go put me for mood since now.
Sorry, I didn't even know you were muted, sir.
Man, I don't know whether I'll be asking for the permission, but you didn't see it.
No, sorry. Okay, you can close this session now.
Ben, I'm not saying that your handwork, but no wahala. They do. Your children just they disturb everybody.
Yeah, exactly.
Old age don't they disturb you, small. Ogonna.
Closing prayer.
I cite you.
Ogonna.
Yeah.
my
I just want to say thanks to you and you. Thanks to you.
Can you imagine the question?
Thanks to you and your team for bringing Edith on the show. I really enjoyed it, and also want to thanks all who participated in the show. God will continue to strengthen us. I know that from time to time I know it will not be something of every week, but I know from time to time we'll be having good interaction like this. At least today, I really learned a lot, and I think God will continue to keep us together. We'll continue to practice love. We'll continue to move in unity, and we'll continue to love one another. We'll continue to help each another. Thank you guys for being on the show tonight. God bless us all. God bless our family. God bless our handwork. Then what she have taught us, let's put it in practice. Because me, I really want to clock over 80s. God bless you and have a wonderful night with your families.
You too.
Okay. All right. Good night, everyone.
Going to be 100.
Good night. See you all.
Good night.
At this stage, I'm going to end this the meeting. We will continue on the WhatsApp platform.
Yes, please, let's get the recording. I noticed you recorded it. For the people that were not able to,
yes,
to join.
But I think I'll just send only the audio. I don't know if.
Yeah, only the audio is.
All right.
Only the audio is okay.
Okay, I'll just drop it on the platform.
So they will not see Benedict's face.
Good night, everyone. But maybe I'll remove the part where she promised money. So that the money will be enough for MOD and Chikadri.
Yeah.
All right, good night.